So we'll just get right down. Are you okay with that? Okay.
Abby, come here.
You can bring that a little. Never mind.
Do you want me to just start kneeling? I can just.
No, you're good.
Okay.
Let's say, Steven, can you pull that mannequin towards Gary a little more? Thank you, sir. Gary, you can take a little step back.
Okay. All right, stand by.
Roll this. If that eventually clicks on.
When an emergency happens, every second counts. So let's get right into it. We are joined right now by Steven, who is a CPR instructor. So Steven, in the case that someone may need CPR, what are we doing before we perform CPR?
The first thing you're going to do is you're going to verify scene safety. You want to make sure the scene is safe so you don't become a second victim.
Okay.
Once you know the scene is safe, you want to make sure that the victim's going to be safe, that they're not going to become any more injured. Once that's take place, you want to check for responsiveness. You want to tap the chest, see if they respond. If they're not responsive, then you need to alert 911.
Okay. And tell someone else too.
Absolutely. If there's someone else around, have them call 911 because we know they need medical assistance. Then we're going to do our assessment. Next thing you're going to do is you're going to check the carotid artery for a pulse, and you're going to check for breathing. You're going to want normal breathing. Anything other than normal breathing is considered no breathing at all. After this point, there's no pulse, no breathing, then you want to give compressions on the lower third of the breastbone.
Just gonna start right now.
Okay, you're going to give 30 compressions. You want to go at least 2 inches deep.
And as you can see, there's a green light there in this one that is pointing saying I'm doing it the right way.
Absolutely. The 2 green lights indicates you're going deep enough at the right tempo. And the tempo you want to use is 100 to 120 compressions per minute.
So very fast.
Correct.
Okay.
You'll give 30 of those, and then you're going to check the airway for an obstruction. You'll look into the airway,
Nothing there.
no obstruction, then you want to give 2 breaths.
Okay. So the back.
Correct.
Plug the nose.
Use the head tilt chin lift, plug the nose, you give 2 breaths, and the most important part now is you want to look for rise and fall of the chest. If you don't have rise and fall of the chest, then you're not giving effective breaths.
So after that, what do we do then?
It's rinse and repeat. Compressions again, and then 2 breaths. You'll continue to do that until EMS shows up. But if there's 2 rescuers, what you're going to do is you're going to do 5 cycles of that, and then you're going to switch, and that should prevent fatigue.
So you and I would do one and one. Okay.
Absolutely.
So that's for an adult. Real quickly though, we want to show the difference if there is a child involved. What are we doing in this case?
In this case, if it's 1 rescuer, you're going to use 2 fingers, and you're going to give 30 compressions and 2 breaths, just like the adult. Instead of checking the carotid artery, you're going to check the brachial artery or the femoral artery.
So the arm or the leg there.
Correct.
Okay.
If it's 2 rescuers, you're going to use what's called the encircling thumbs technique. You're going to give 15 compressions, while the other rescuer, who's going to be
So at
perpendicular,
that point, I would give the breath.
absolutely. So you give 15 compressions, and then you would give the 2 breaths.
So now to real quick, we have about 15 seconds. I'm going to show how we would do it if it's just 1 person. I would then be taking 2 fingers right here. Is that correct?
Correct. At the lower third of the breastbone,
And how deep is this going to be?
that's going to be 1.5 inches or 1/3 of the body depth. The
Okay.
1/3 second minimum applies to pediatrics, children or infants.
Now, Stephen, let's be very clear. We are in a home right now because a lot of these classes can take place in a home. Instructors either you could come to their home or they can they can go to theirs. Either way, but it's kind of an informal way. But it's really a way to get more people together at once to learn this, maybe together, just to make it easier for people to all learn at one time. So I want to keep in mind that if you want to get a few people together to do a class, very simple, call someone like you. If you do want to call Steven and get a class, we do have that information up on our website, abc-7.com. Coming up on Facebook Live, we have a lot more to talk about, including AED use, which we see behind us here. Also, in the case of someone choking, what we do. That's all coming up on Facebook Live at 7 a.m.